Welcome back. Thank you so much for joining us in this live stream that we have today all day, well, between 9 and 8 p.m. on World Cancer Day. And I'm very, very happy to be taking a little bit of time to look a little bit inside of the Eastern Mediterranean region to see how are they closing the care gap. And for this very special segment, and as a testament of the live event that we are conducting, we had a little bit of a technical issue. So one of my guests is joining us, and the other one, unfortunately, for these technical issues, is not yet been connected. So we are going to go ahead with introducing Hana, Hana Chaar Choueib. She's the General Manager of the Children's Cancer Center of Lebanon. Well, she's an exceptional leader and advocate for childhood cancer. And well, she has been leading the Children's Cancer Center for 10 years, making it one of the leading centers for treatment and support of children with cancer in the Middle East. So, Hana, welcome, and thank you so much for joining us today.
Hello, Laura. So exciting to be here today.
It is indeed. So just in case we have finally our second guest joining us, let me introduce him as well for everybody to know. His name is Dr. Seyed Mohsen Razavi. He's a hematologist oncologist, member of the board of the Mohammad Hossein Razavi Charity Institute from Iran. That is the only organization focusing professionally on young adults with cancer. And this organization has been founded in 2017. So, Hana, I'm going to start with you. And actually, Hana is a member of the board of directors of UICC since 2020. And nobody better than you that give us perhaps this regional perspective on what are the gaps in cancer care in the Eastern Mediterranean region. So, over to you, Hana.
Allow me first to say a big congratulations to all the UICC World Cancer Day team for the new theme. Actually, it's a very beautiful one, and it just hits the right notes. The campaign had been going great so far, and I see lots of members are enjoying it. So congratulations again.
Thank you.
Actually, the recent statistics in the Eastern Mediterranean region, they indicate that it is witnessing a rise in cancer cases. And due to crisis in several countries across the region, cancer care gaps widen and increase every time. We're facing different problems. And this is affecting this is affected basically by the limitation of resources, by inequitable distribution. And this is the importance of the theme because it highlights and it pinpoints these issues. Now we have several barriers and inaccessibilities for minority and refugee population. And we have as well limited capacities among healthcare professionals and workers. And this is also in addition to the absence of policies and national strategies implementation to ensure adequate cancer care. We have like the awareness and the cancer prevention campaigns are still very shy. And this is what we're trying hard to highlight on and to encourage everyone to focus on, as well as the access to screening services. And here COVID played an important role in also hindering most of the people to go to the regular screenings that they, and to the monitoring that they usually supposed to have. This is specifically in some low resource settings. And also we have the access to adequate treatment, which can be very difficult in several crisis zones. Nevertheless, the region always boosts with action, and there is too much momentum and cooperation across the countries to support each other. And I think by this, we can help to close the care gap.
That sounds very, very inspiring, and actually really is wonderful to hear. It's music to our ears to hear these comments about the campaign, Close the Care Gap, as you said, like hitting the spot. So this is always, this feedback is always really welcome, Hana, so thank you for that. Now that you gave us we set the scene a little bit on those barriers that you mentioned, can you perhaps tell us a little bit what are you doing to fill those gaps? Like what are the steps that you're doing to close those care gaps?
You see, Laura, it's very difficult here because the region is different from one country to another. And however, I'd like to acknowledge and highlight on the crucial role that the civil society organizations, as well as the NGOs across the region, they're playing a very important role in closing this care gap. Now, several governments like what we have in the United Arab Emirates, they are at the forefront of introducing new policies and strategies to enhance cancer controls. Now, other NGOs across the region have really pioneered in launching campaigns and mobilizing resources to promote awareness and ensure access to treatment and care for the most helpless patients. I think Dr.
We have a little bit of trying to join us from Milan, I think. Continue.
Hello, Hana.
Hello, Doctor.
Yes. Hi, nice to meet you after some troubles.
Oh, hello, Dr. Razavi. Nice to see you. Well, no, we don't see you yet, but
Thank
we hear you.
Glad to have you finally.
Glad to have you. Dr. Razavi, if you don't mind, Hana will finish with her intro. She was giving us a little bit of like some information, so we will continue right back on you, if that's okay. Hana, please continue.
Yes, I was just highlighting the importance the NGOs are, the role of the NGOs that they are playing across the region and how they have pioneered in launching campaigns, mobilizing resources, all of that to promote awareness and to ensure access to treatment and care for the most helpless patients. A lot of regional collaboration and global reach is being done to empower healthcare workers with knowledge and capacities, and also to enhance services. We at the Children Cancer Center of Lebanon, we ensure access to adequate treatment and care to all patients with cancer in Lebanon, and are engaged with all national stakeholders to enhance our cancer control strategies and policies, despite all the challenges that the current ongoing crisis is posing on the country.
Excellent, Hana. Thank you so much. I'm really sorry, Dr. Razavi, but it seems that we cannot connect with you at this on this occasion. Hana, perhaps we can pick it up there. You were talking about lots of examples in the region. Can you perhaps expand a little bit more about what are you specifically doing in Lebanon and in the Children Cancer Center?
Yes, well, actually the past 3 years have been very, very difficult for all the Lebanese people, as well as for anyone residing in Lebanon, because many crises were happening one at a time, and like you have not even been done from the first one until you start with the second, and it's very difficult to cope with all of that. So with all the political uncertainties, we had the financial and the economic crisis, as well as the pandemic and the explosion that happened in August 2020. However, so this all had played the major role in having all the efforts on a national level are really very scarce. And the civil societies are taking initiatives to close this care gap. One of the main challenges we face is the financial burden and the out-of-pocket payments by patients, which is due to the devaluation of the Lebanese pound. This had been really very difficult and had deprived many of the families and many of the patients not to continue their treatment. So add to this, this crisis and the devaluation of the Lebanese pound, it played a big, it was a major factor in allowing most of the, in having all the immigration of most of the medical staff, which led to downsizing some of the hospitals and the absence of some expertise. To cope with that, the Children Cancer Center of Lebanon, we had launched its national fund program, which is to ensure access to and coverage of medical and psychosocial treatment to all childhood cancer patients in Lebanon. And this had happened while partnering with 10 hospitals across the country. And we helped, for the past 2 years, we had helped more than 700 patients to continue their treatment and to start treatment, the new cases to start treatment all over the country. In addition to that, something very, very important had happened is that CCCL had pioneered with the national HPV vaccine program. This was as a commitment to the WHO strategy to eliminate cervical cancer, where over 100 children, whose age were between 10 and 15 years, took the vaccine and they took it for free. And here I'd like to highlight a point because we had also some cases of this age bracket who had already started the vaccine, but due to the shortage in medication, they couldn't find it anywhere. And this is where CCCL had stepped in and supported in continuing to provide this vaccine. So here we'd like to have plans. We have plans to grow the HPV vaccine program. And by ensuring definitely this, we can't do it alone, but we need to ensure national and international partnership to provide more access to this vaccine and to create comprehensive data registry and interactive platforms.
Wonderful, Hana. Thank you so much for that. So I think in what you're saying, there is obviously a lot of hope on overcoming these barriers and these gaps in the future. So I would like, if you don't mind, to share with us just as a brief section to finish your speech here. What are you doing to celebrate today, World Cancer Day at CCCL? What is the plan for today?
Well, the day started was so wonderful, and we at the CCCL, we just finished the daily art activity with childhood cancer patients and their parents, and you can see behind me here all the samples of the beautiful work that had been done today. And also earlier today, we had done a healthy lifestyle session to our employees by a licensed dietitian and distributed healthy snacks. We are getting also ready to give awareness sessions about childhood cancer control in Lebanon at one of the most prominent universities in the country during the upcoming 2 weeks. Also, we will be visiting patients across different hospitals all through the month to spread the celebration and solidarity and to honor and thank the healthcare workers who are giving so much and are caring for our cancer patients. Yes, Laura, you had mentioned something is that we need to have hope, and definitely here in Lebanon and in most areas of the region, we face never-ending challenges, but we cannot lose hope. And I'd like here to thank the philanthropists and the contributors who continue to support populations in need. The region, there is a lot of will and determination in the region and in closing the cancer care gap. And we can always achieve success and overcome all the challenges when working together hand in hand. Many efforts here reflect these cooperation and collaboration. I'd like to highlight also that we are jointly with the King Hossein Cancer Foundation in Jordan releasing a statement highlighting the importance of addressing cancer care in for refugees in our region. And also members, I'd like really to congratulate organizers of the Gulf Cancer Week for their efforts and their activation, namely both members of the UICC who are FOCP and QCS. Now, I understand that members are, and I know that members across the region had done many activations. A lot revolving around raising awareness, education, lighting monuments, media, stakeholder engagement, and this is really a wonderful height. We cannot but have hope, and we cannot but also hope to have peace, because of this continued cooperation and collaboration, we will be able to serve and to enhance the lives of people with cancer in general.
Thank you, Hana, and really a beautiful way to finish this segment. Of course, let's hope for peace and inshallah, let's close the care gap in the Middle East, right? It's really a nice way of closing. Thank you so much for being with us today.
Thank you, Laura, and thank you to all the team, especially on this day. I know how hard you work to have it happen and how early you plan to be able to have everything being set and organized and ready for the day.
Thank you, Hana. So thank you so much, and to everyone watching, continue. We will be back in a short break. So enjoy the rest of the live program. Thank you.